Hello, guys. Hello. I am Jewel and welcome. Welcome to my channel, guys. First of all, I hope all of you are doing great, that your health is steady, that you have everything you could possibly need, and the children and your family are just doing well. I send you love and blessings, and hopefully, you guys are straight. You're following all the guidelines from the CDC, and of course the kidney community by doing what we've been doing for so long now, which is staying at home when we don't need to be out. You know, um, Social distancing when we are wearing a mask everywhere. That we go without being at home. When we are at home, of course, we don't have to wear one. But as soon as you walk out your door, make sure your mask is on, of course, and just hoping and praying that everyone is following these rules because, of course, we are in, like I said, a big crisis in this country. There have been over 2,800 people within the last couple of days that have lost their lives to COVID. So, as you can see, this is something that's, very huge, not only for this country, but for people all over the world. So, for many of us, our job and our obligation is to take care of ourselves and our families by doing the right thing, which is wearing masks wherever we go. But for so many of us, guys, there are so many of us out there that are suffering in ways that, I don't think that we have seen in this country for many, many years. People are losing their lives, at a fundamental rate. And of course, as they lose their lives, that means that all these families of 2,800 people have lost loved ones. So, of course, they're suffering. So, let's send them love, guys. Let's send them kindness. Let's send them care to let them know that they are not alone in this journey. And, of course, for all the healthcare workers that are on the front lines of this terrible virus, we think about you. We love you. We send you love. And as you know, that this vaccine is coming to all of us, but there's going to be many steps that they have to go to even reach all of us. The first vaccines, of course, is going out to the healthcare workers, which they need desperately because so many of them have passed away, guys, because they tried to take care of all of us that were sick. So that is such a great idea that they get the first dose. And of course, the second dose goes to the people in nursing homes because remember, they are the ones that suffered the most when this virus first showed itself. There are so many of them, so many in nursing homes, of course, with families and loved ones that love them desperately that have passed away. And so, I'm so happy that they are, going to be taken care of second. For us with CKD and of course with diabetes and all of those diseases that impacts our immune system. For us, we I don't know. I have been watching and going through all the websites of kidney websites and so on, and nobody has said anything yet about this vaccine when it comes to kidney patients and heart patients and diabetes patients, because I'm sure that all of our doctors, nephrologists, heart doctors, all of those that need care. I'm sure they're paying very, very close attention to this virus, but no one has said anything yet. So I don't have any information about what the top nephrologists are saying about us as kidney patients, or what we can do and when this is coming to us. But I will be diligent, and keep watching for all of us to make sure and give you the information when it first starts to come out to let us know, when and what this virus, how it's going to impact us. But for those of us that, of course, guys, there's so many of us that have lost jobs, that are sick, not just with immune deficient diseases like kidney disease and heart disease and diabetes. There's so many of us that are sick with regular illnesses out there, broken legs, arms, cold, flu, that are in the process of being treated also during this COVID-19 crisis. So let's pray for all of those guys that are, trying to get treatment through this crisis that is going on in our country and all over the world. This is one of the toughest, I think, things that we as a country and us as citizens have ever seen in this generation. And so, it is a very tough thing to deal with. Sometimes thinking about it can become so overwhelming because, all the people that are passing, all the people that are sick, and so many people that, that are lacking right now in food and places to live and so many things that I don't think that any of us have seen in so long. So for those of us that are doing okay, that our health are holding up, that we have enough to pay our rent and food. If you have anything extra, guys, let's share it. Let's share it to food banks. Let's share it to all the organizations that are helping others through this crisis because we are all really in this together. And I don't think that we can go through this without each other to hold us up, to help us get through this. So let's do our part. Those of us that are doing okay, let's share what we have. Let's send out love. Let's send out prayers to let them know that are going through so much that they are not alone in this crisis and in their suffering. It is it is a hard time for us right now, guys. Especially the information that the CDC is telling us right now that this is going to be one of the toughest winters that all of us as citizens have ever gone through because of this virus. So guys, all I can say is let's be very, very diligent in what we go, what we do, not only for ourselves, for other people around us. Because remember, we're not just taking care of ourselves, we're taking care of our family and our friends when we, you know, comply with all of the rules and regulations of the CDC and the National Kidney Foundation and all the kidney organizations out there. We are together as a country going through this crisis. So that means that we have to help each other go through this crisis, which means to do with everything that we can do for others, but also to keep ourselves safe, and going about our own business. So, guys, as this week goes on, and this weekend, and as this winter continues, let's always be mindful of the people that are suffering. Be mindful of what they're going through and be mindful of all the people that, that need us as their neighbors, their friends, their countrymen. And let's always, of course, be, available in every way that we can to those in need, but also, of course, keeping our own self safe. So, guys, I just wanted to say to all of you that I'm thinking about you, sending you so much love, so much affection, and just knowing that we are together in this crisis. Let's be loving and kind, and and show others that we care and that we're all in this together. So, guys, in the interim, I send you love and care, and hoping and praying that you guys are doing well and of course your neighbors and friends and all of us that are going through this. So guys, just take care of yourselves and know that you're not alone in this crisis. And of course, for those of us with CKD and all the other health crises that puts us in a very vulnerable position, all that we have to do, of course, is just do what we've been doing, taking care of ourselves and our families and all those that we love. So, guys, take care of yourselves until the next video. And I send you, like I said, love and care. And just let's let's just multiply that by sending love and care to everyone we know, everyone we don't know, and just to the world in general. So this crisis may leave us, and we will, follow a next chapter, which is 2021, and hopefully and prayerfully that will be a change for all of us that we can get behind. So, guys, and first of all, I cannot wait till this vaccine comes, and wait to see what the top nephrologist says about us with CKD, and when we will be able to take it and how safe it is for us. So let's just follow the information, guys, and just stay safe. I will talk to you guys on the next video. And in the meantime, if you like this video, please like, share, and subscribe. Talk to you soon. Bye.